I'm gonna give you an outline of a multidisciplinary project that we have developed to assess and explore the impact of infection control measures following an outbreak of respiratory disease on the quality of life of residents in care homes. This is the VIVALDI ASCOT Ethnography Study, which is funded by the NIHR and the UK Health Security Agency. And first of all, the team. So the VIVALDI ASCOT Ethnography Study is led by Dr. Dorina Kadar. The co-investigator is Professor Jackie Castle. We also have Dr. Nicola Schmidt-Renfrey, who's a research fellow, and myself, also a research fellow. And this is based at the Center of Dementia Studies here at Brighton Sussex Medical School. The study is linked to the wider project, the VIVALDI CT, which is a randomized trial of COVID-19 testing for staff led by Professor Laura Shawcross at UCL. So we are currently collecting data, so I will not be talking about the findings, but I really want to talk about the design, the mixed methods design of the study. But first of all, why we thought this was an important topic to explore. So we know from COVID-19 that older people who live in care homes are at higher risk of developing serious disease from COVID-19 and other respiratory diseases. This is really important, and it is still very topical because at the moment we will be experiencing outbreaks of COVID-19 and other respiratory diseases like influenza, norovirus at the same time. So there's a possibility that care homes are dealing with different outbreaks at any given time over the year. The vulnerability of this cohort of people to these type of viruses is because of many different circumstances, which includes frailty, comorbidity, and a high proportion of residents with dementia. We think that about 2/3 of people in care homes in England, in the UK, sorry, have dementia. There's also the induced transmission of virus, and the type of personal care that is provided in care homes, which requires high touch activities like toileting, cleaning, helping with eating, and proximity. And we know from studies from COVID-19, from the COVID-19 pandemic, that some of the non-pharmaceutical interventions, such as social distancing and isolation, were really difficult to implement in other social care settings. But we also know that these interventions, and particularly the lengthy and strict lockdowns, the visit restrictions, and the lack of social activities had a real negative impact on residents' well-being and functional ability. And this was particularly important to understand for people with dementia, for whom social interaction and touch are particularly important. So the impact on residents' everyday life was massive, but and this is why throughout the pandemic there were interventions to try and find a balance between the physical safety of residents as well as their well-being. However, to this date, we don't have a strong body of evidence about the experiences of residents themselves. And we also don't have a standard approach to assess and describe the impact of outbreaks on these populations' quality of life, as has been also highlighted by the Chief Medical Officer in the technical report on the COVID-19 pandemic in the UK. So this is why we then developed the VIVALDI ASCOT Ethnography Study with two aims, or two main objectives. The first one is to understand how outbreaks of COVID-19 or any other respiratory illness impact the quality of life of all the people who live in care homes. And the second is to demonstrate a practical and standard approach to assesses the impact and collecting primary data from all the residents in care homes, including residents with dementia. So a bit of a very briefly the design of the study. So the study is a multi-method, mixed methods longitudinal study, which includes two main components. So one component we called it the VIVALDI ASCOT, is a mixed methods interview, where we will be interviewing 50 residents from care homes with no recent outbreaks, which we call group 1, and 50 residents from care homes with a recent outbreaks, which we call group 2. By recent, we mean within 3 weeks from the outbreak, at time 1. Then we will repeat the same interview at time 2, which is about 3 to 4 weeks later. And we will be interviewed the same amount of residents from group 1 and from group 2 for a total of 200 interviews total. At the same time, in parallel with interviews in time 1, we will also carry out focused ethnographic observations in up to 5 care homes from group 1 and up to 5 care homes from group 2 for a total of up to 10 observations. So this is very briefly the design, and I'm going to give you a bit more of a in-depth description of each method. So the VIVALDI ASCOT is a face-to-face longitudinal and mixed design interview, which aims to measure the impact of COVID-19 or other respiratory outbreaks on care homes residents' quality of life, psychological well-being, loneliness, and functional ability. So we will be using well-established measures that have been combined into this interview. A bit more about ASCOT. So ASCOT is the Adult Social Care Outcomes Toolkit, which was designed, and it is a well-established tool for measuring social care-related quality of life in adult social care settings. And that's why we thought it could be a good kind of measure to use to also measure the quality of life, the impact of outbreaks on quality of life. It has 8 domains, 4 basic domains like food and drink or personal safety, and 4 higher domains like dignity and control over daily life. And I've heard from previous presentations today how these are all important aspects of residents' quality of life in care homes. The second methods that we are using is short-term ethnography, which is composed of 2 different methods. And this is to collect in-depth data on communication and how the reorganization of spaces and activities following an outbreak impact on residents' quality of life and social connections. So the 2 methods that we are using are 9 open-ended questions on the use of space and communications in care homes, and this is included in the in the interview. And then focused ethnographic observations. These are about 60 minutes observation in communal spaces of care homes, where we look at how people interact, the type of communications between residents and staff, etc. And we want to understand and compare between the 2 groups to understand if there are any differences and what the differences are. So before I draw to a conclusion, I just want to give you a bit of a very brief idea of how we have tried to make these inclusive and trying to include as many residents as possible who are able to consent to our study, but also have a degree of dementia or cognitive impairment. So we have been very careful to design very inclusive type of participant information sheet, and also having shortcards, including images in our communications and you know the documents that we share with the participants. And part of using also an ethnographic approach and using observations is because these are more immersive type of data collection that do not require memory or recall, which or verbal communication that can be challenging for some people with dementia or older age. And so this is what we have been trying to do with the VIVALDI ASCOT Ethnography Study by choosing a multidisciplinary approach. So to conclude, this study addresses two key priorities that are related to the equality and equity of evidence for these vulnerable populations so that we can inform policy on the proportionate measures to take in the event of outbreaks. And in particular, this study develops a standard approach to assessing the impact of outbreaks on residents' quality of life and psychological well-being that is very much needed to inform policy. And also, it tried to give you an example of how to include the experiences and understanding of residents on the impact of outbreaks and infection control measures on their lives in care homes. So thank you very much. If you would like to know more about the study, please do email us, or you can check the website. And thank you. I don't know if there's time for any questions.
Okay.